All right, so in 2004, I was the medical director of an ER. My founding partner, Dr. Platt, and Kevin and Steve, who are also partners of when we started, all started thinking about, I particularly started thinking about, what if there was a place to go for a sprained ankle or a laceration, or when you're sick, have the flu, whatever, where you don't have to go sit in an ER, get treated like an ER patient. And it had amazing customer service, and they took care of you, and the patient was more important than the doctor. And that was a new concept back in 2004. So what you have to remember and realize is, in 2004 there were no urgent cares. It was a new concept. Nobody ever heard of it. And so we kind of invented it, as I say, me and 8,000 other people around the country at the same time. But really, we looked then to see if there were any mentors or people who could help us. And there wasn't. The Association of Urgent Care had just been formed, and they really didn't have any members or know what they were doing yet either. So we really were in the beginning, but our goal was to take care of people in a better, faster, and more better fashion. Take care of people. So that was the principles that we started it on. I think I was taking care of a patient one day, and they'd been waiting in the waiting room for like 2 hours because it's a busy ER, busy season. And I think they had a sprained ankle. And I was sitting there taking care of her, and she's like, I said, how come you didn't go to your primary care doctor? Well, my primary care doctor doesn't take care of bones. And I was like, isn't that interesting? If you sprain your ankle, the only place to go is the ER, because most primary care doctors don't do orthopedics. And so I started thinking, what if there was a place that was kind of like an ER, but was kind of like primary care, and was in between those two things, but actually had a really good customer service. So that was the moment. I've taken care of a lot of patients over the years. I've done a lot of things for people, and I was also the medical director of the homeless clinic. We had a homeless clinic, and I went over and took care of those people. So I kind of had a vision of taking care of all different people from all different classes of people, and so that helped me. Yeah, our values have been the same since we started. We opened 18 years ago. We started thinking about our values 20 years ago, and we wrote them down then, and they're the same today. And that basically is that we're going to provide amazing customer service to our customers / patients, an awesome place to work, financial success, and great medical care. Hundreds. Like running a business is like anything else. There are a lot of pivots along the way. There's a flu season one year, and there's COVID another year, and there's financial problems another year, and employees leaving another year, and too many employees another year. So I think it's a series of pivots along the way. We never changed our values, but we changed our hours, or we changed the number of locations, or we changed how we did business. That's been a continuous change throughout the years. And as you grow, we had 7 people when we started, and now we have over 400 people. So obviously you have to change the way you handle all of that stuff. HR department was essentially me, and now we have a full HR department. So you have to grow that as you grow the company. When we first opened, that was a big milestone. Nobody in this town, at least, thought we were going to make it. Like, nobody. They're all like, no, you built the building too big. Nobody's ever done this before. You guys are going out on limb, blah, blah, blah. And sure enough, it did seem like that for a little while. I remember the first day we saw 10 patients. We all did cartwheels down the hall, jumping up and down, excited because we saw over 10 patients for the first time ever. And so just getting to that point where we could do that. And all of us were all in, who were in it then. In fact, everybody who was in the beginning is still here, amazingly. We still have the same people here who were here then. And so it tells you how all in we were. We all have different jobs now, we all do different things, but we're all still here. And that was a big milestone. I think another milestone is when you open your second location. And so, because in the beginning it was just gonna be one clinic where we worked and raised our kids and retired. And then we saw the need, and so we branched out and opened a second. That was a big move for us. And then I think the third would be when we opened our first location that wasn't in the same town, that was further away, a couple hours away. That was a big move and a whole new learning experience of how do you manage something that isn't in the same town you are. So Those are big ones. Feels like I got old. So I raised 5 kids, and the 6th one, I guess, is Healthcare Express, because I grew up with my kids. They all grew up in it, and they're all part of it, and been a part of it their whole lives. And so I feel like I have another 18-year-old who I'm ready to send off into the world. Yeah, no, it's been tremendous growth, and growth goes in spurts, right? It kind of plateaus for a minute, then it spurts up again, then it spurts up again, and that's certainly what has happened. Like, we built 5 clinics 1 year, and then we didn't build any for 4 years. And so that's kind of how it's gone as far as our number of locations. Our patients have just steadily increased over the years. Our first year in business, which was 2006, we saw 13,100 patients for the whole year. The last several years, we've seen over 200,000 per year. And so that's continued to grow, and I think we calculated yesterday, we've seen over 2.3 million patients since we started, which is an incredible number. And most of those have come on multiple times, so they're coming back. They're not just, they want to be here, they want to come see us again. So that's something. Make sure you educate yourself on what it takes to be successful in a business, what character traits you have to bring to the table, and be willing to grow those character traits and change over time. There's been so many people help us along the way. There was the original group of us that were here, but then so many people have come in, left, some have come back, some are still here, and even some who are not here have been fundamental in taking us from where we were to where we are. And it's hard to, I don't want to name individual people because there's so many. I would be afraid I would accidentally forget somebody, and then I'd feel bad later on. So I'm just going to say, as a general rule, the large majority of all the people we've had have been all in. They've wanted to be a part of something bigger than themselves. They've wanted to provide amazing customer service to our customers. They've wanted to be part of the whole experience. The best part of the last 20 years has been getting to know all the people that we've all got to be known and be close to.